So this is how we are trying to see that and what difference it has brought. According to the National Family Health Survey, the 79% institutional deliveries have increased to 89, means 90%, reaching 90% institutional deliveries. Now how it is done? It is the responsibility of the ASHA worker to take the patient to the institution, get her delivered. If there is a complication, see to it that a complication which is being taken care by the government institution, and bring the patient back to home. Transportation is free. Incentives are given to ASHA workers for each delivery which she gets done in the institutional delivery, and this is because now we are reaching 90% of institutional deliveries. If I talk about MMR, maternal mortality ratio, according to the SRS, it was 130 per lakh childbirth, and now it is reduced to 88 per lakh live births. 88. There is a reduction in 42 points, which we have to understand. And all this has taken in just 10 years, in the past 10 years. And this figure I am giving is in 2021, not in past 10 years, in past 8 years. And now the figures will be much more encouraging if I talk about. If I talk about the infant mortality rate, it was 39 per 1,000 live births, now it is 27 per 1,000 live births. And under 5 mortality, the decline is 42%, and the global decline is 14%. So you can understand that how India is answering the basic questions of the healthy child, and how we have to see to it that if I talk about neonatal mortality, the decline is 39%. and the global decline is just 11%. That means with the speed with which India is going forward in the decline of the infant mortality rate and the neonatal mortality, that we have to understand. And what is the roadmap which we take? In the past 10 years, I can say that after 1997, when we had the health policy, in 1998, it was in 2017 that we developed a new health policy. Now this health policy was not decided or discussed in Nirman Bhavan. This was discussed with all the stakeholders. We had regional conferences, we had conferences in the states, we had discussion with all stakeholders, and after immense consultation and keeping the health policy basics in public domain, we came out with the health policy of 2017. Now that is a landmark health policy in the sense it brings a change. What is the change? Previously we were thinking in terms of only curative health care. It was in 2017 that we started thinking a comprehensive health care. पहले हम सोचते थे बीमार पड़ा तो इलाज कराओ, हमने सोच बदली कि बीमार पड़े क्यों? Why should anybody? We should have a promotive health care. We should have preventive health care. And we should have early detection. So with this, we developed a comprehensive health policy. I'm discussing this because for the last, since yesterday you have been discussing about the best practices which you have been undertaking and sharing the best practices. But now when I come, it becomes my primary responsibility to share with you what is the thought process of government and the policy makers and your contribution into it. How do you contribute into it? So then comprehensive health policy, we develop preventive health care, promotive health care, palliative health care, curative health care, geriatric health care, and very important part was early detection. When we say accessible health care, तो access कहाँ मिलता है? Where is the contact point? So we expanded the base of health care, and for that we developed 1.7 lakh Ayushman Arogya Mandir, which is the first contact. And in that contact, we tried to see to it that we are able to give them equitable healthcare, affordable healthcare, and accessible also. So we developed a scheme which we called as a community health officer, in which there is a community health officer, doctors, nurses, and that is the first point of contact. Now, when I talk, I also would like to share with you that this Ayushman Arogya Mandir has got 12 kinds of packages. We take care of eye and ENT, early detection of eye problem, ENT, ear, nose and throat. We take care of the dental care, we take care of the mental care, we take care of the hypertension, we take care of the diabetes, so that the early detection takes place. But the most important which I would like to share with you, that we also provide free drugs and diagnostic facilities. And I would also like to share, because Niti Aayog is doing the third party audit of how the diagnosis and drug facilities are being provided to the common man. But the most important was the reproductive and child health care. This is one of the very important aspects for a healthy India.